All right, this is a talk that I've been wanting to give for a long time about IBS and GI dysbiosis. It's a talk that I give almost every day in practice with my patients, and it's time consuming to give it to each individual person. So I want to get this information out, disseminate it so that people can have access to it and understand a little bit more about IBS and how common, how prevalent it is, but also what it is and how to fix it. And so I'm going to dive into that today. So starting with what is IBS? And by definition, it's basically just a syndrome, which doesn't really tell you much. It doesn't tell you why, it doesn't tell you the cause, it doesn't tell you really how to fix the problem. There are lots of therapies that are used to manage the diagnosis, but we want to resolve it so that we're not just having this problem ongoing, and we don't want to have to just simply stay on therapies indefinitely without making progress. Now, some of the therapies are helpful, and in the meantime they can be utilized, but you also want to address root cause, and that's what we do here. So by definition, IBS is basically a bunch of symptoms of gas, discomfort, bloating, stool changes, sometimes heartburn, things like that, that create irritability in the gut. Usually they're stress related, or some type of environmental change can cause the symptoms to be worse. And oftentimes there's a lot of treatments like omeprazole or proton pump inhibitors, Pepcid or fiber supplements, or sometimes dietary changes even, which is great, a good start. And all those things are, ways to help support the symptoms of the diagnosis, but they're not solving the problem. And really we have to understand why the IBS occurred. And so you want to kind of trace back as to the origins. And we're going to talk about some of the main causes today, but understanding your timeline is huge. So knowing when your symptoms kind of started, even if they were gradual, kind of tracing it back. Was there an event? Was there a preceding situation that might have onsetted this possible diagnosis? And if that's still ongoing, then you need to address that as well. So what we really know about IBS, and what's strongly correlated to, is that it's a microbiome change. So it's a dysregulated digestive system, and it's strongly related to the microbiome of the gut, because the microbiome, where the bacteria, the fungus, the parasites, the viruses all live together, they help with digestion. They help with everything in your body in regards to symptomatic function. And so if there's a microbiome change, where we call it dysbiosis, there's an irregularity in bacterial growth, or fungal growth, or location of growth, or quantity of growth, then we can have symptoms. And naturally what IBS comes down to. So when I approach an IBS patient, or someone who has the symptoms of IBS, the approach is understanding the clinical history of the symptoms. So time and onset and the progression of the symptoms since. Has the symptoms changed, or have they been pretty consistent throughout? Have they gotten worse? Have they gotten better? Those are all considerations that we need to make. And what has caused those worsening or better symptoms? Now, in addition, you want to know what other symptoms have coincided with this. So is there headaches? Is there any type of fevers or signs of illness? Is there any additional body aches or joint pains, or what other changes may the body be experiencing at this time? Can tell you a lot about what may have caused the microbiome change. So again, what treatments I've tried? I tried probiotics that made me much worse. Okay, so that means that there's definitely too much bacteria there, and adding probiotics probably is not the best option at this point in time. Now, are probiotics bad? No, but it is a timing problem. And it's also, you have to talk about what type of probiotics and quantity of probiotics and quality of probiotics. So there's a lot of detail there. But understanding, hey, I got really a lot better on this diet or whatnot can really help. And then, what is the patient's or person's diet and lifestyle? Are they someone who's really on the go, stressed out, eating a lot of fast food, and exacerbating their problems? Or is it someone who is taking care of themselves and doing a really good job with stress management, exercising, eating well. And then we can actually approach this diagnostically. And I advocate for that for a lot of my patients because it tells us a lot more about the details of what's going on. It's more information for us to treat the patient effectively. So there are other tests. I mean, traditionally there's scoping, which is the endoscopy and colonoscopy. A lot of GIs will look and see what's going on there. Sometimes they'll do a barium swallow, which is an x-ray, and look at motility of the gut and make sure there's no obstructions or in the normal passage in the gut. And all those things can tell us a lot about the structure of the gastrointestinal tract and lining, but they're not going to tell us a lot about the microbiome. And that's where functional medicine kind of steps in and says, okay, well, let's test the function of the gut. And let's look at, is the microbiome working effectively? Is the digestive tract working effectively? Let's look at stool testing, breath testing. We can even look at blood markers for inflammation. We can look at different inflammatory markers there. But realistically, we don't have to do all of those, but a combination of a few of those might be really helpful in addition to the symptoms and the history of the patient, make a huge difference in regards to diagnosing the problem effectively. So what are the major symptoms of IBS? And the big ones we know are the stool changes, the alternating diarrhea and constipation. And that's a common one, especially with like stressors or diet changes or lifestyle changes. And that, can come and go. And sometimes there's not a pattern to it, but stool changes indicates that the body is compensating to try and either flush something out or it's not digesting well and the function of the digestive tract is not pushing things out. So there's definitely an irregularity there. So that comes, that results in incomplete emptying, abdominal discomfort. I don't feel good. My stomach is bloated, especially after I eat, or I have these abdominal pains. I have to press on my stomach. And then you get the secondary byproducts of, I get nauseous. It can even lead to vomiting sometimes, occasionally. A lot of bloating presentations. Hey, I just feel pregnant. I feel like my belly is just distended. And that usually ends up resulting in gas, either burping or flatulence. And depending on which location it's coming out of, can indicate kind of where it is in the digestive tract. And that's not always perfect, but that can be indicative of what's going on. And then when you have these symptoms, you're going to have inflammation in the gut. And that inflammation is going to end up in what's commonly termed as a leaky gut or a microbiome inflammation that's leading to permeability in the intestinal lining. And that can result in food sensitivities where the body is more reactive to certain foods because they're passing through the gut lining and becoming reactive with the immune function. So food sensitivities are part of the equation here. I don't tolerate dairy well. I don't tolerate eggs well or coffee, or usually it's something that's over-consumed. So it's the common foods that people eat a lot of. And then it can even spread systemic. And this is where functional medicine, alternative medicine can really understand more holistically what's going on. I'm more fatigued. I have joint pains. I have headaches. I have brain fog. I have weight gain or weight loss. And those are signs of inflammation that are spreading systemically from the gut, where we're kind of having to address the root problem. So now the good question is, what causes the problem? And commonly it's never just one thing. It's commonly a combination of things, a perfect storm. And so for most people, that microbiome change is a result of feeding the bad bugs in different ways. So the common SAD diet, or the American diet basically, is high carbohydrates, high sugar, the common burgers, pizzas, just the easy accessible foods, the fast foods, things like that. And that's going to create some irritation, inflammation in the gut, which will affect its function. Eating habits are a big one as well. Typically in America, we eat on the go. We stress eat. We just shovel food in our face. We don't take time to eat. We don't de-stress beforehand. We got 15 minutes to throw some lunch in our face, and that was it. And that's usually going to end up in poor digestive patterns. And then secondarily is another big one is low stomach acid. Stress will cause low stomach acid. Medication will cause low stomach acid, which brings us to like the PPIs, H2 blockers. If we eat a lot of irritating foods, we get heartburn, and all of a sudden, or even if we eat a lot of bad foods, we get weight gain, and then we get heartburn, and then we end up taking the medications that are recommended to us, like PPIs or H2 blockers, and that can result in stomach acid decreases. And that in turn, low stomach acid will allow for infection, because stomach acid is designed to kill any bugs that are coming in through the oral cavity and down our esophagus and into our intestines. So if our stomach acid is low, we're allowing for more bacteria, more fungus, more parasites, whatever it is that we're consuming to enter our digestive tract more commonly. And then once it's past our stomach that hasn't killed the bugs, we now have to rely on our immune system to fight them off. And if your gut is leaky because there is so much inflammation there because of the poor foods you're eating, then you end up with a lot of immune dysregularities that can't handle the infections. So you see how the cascading effects happen. Another big one is other medications like opioids, which slow down the digestive tract, antibiotics, birth control pills, all affect the microbiome directly. And so what we're going to end up seeing is that change will cause irritability and result in IBS diagnosis. Now, just like we talked about before, the result of infections, you can ingest them through poor mouth hygiene. So if you have dental cavities or dental infections or poor hygiene in your mouth, you can end up with a lot of bacteria, and you can be swallowing that down consistently. Same thing with postnasal drip. That can result in a lot of stomach dysregularities because of the way that it goes through the gastrointestinal tract, and it doesn't get killed by stomach acid, and all of a sudden you end up with an overgrowth of bacteria. And then in addition to that, other infections, co-infections like chronic infections, viral infections, Lyme disease, mold toxicity, other toxins can all affect the immune function, and the immune function will keep your microbiome in check, kind of regulating it. So if you have other coexisting infections, that can affect the stomach lining and the motility and the ability to tolerate the microbiome the way it is. And another big one people don't really think about is posture and positioning. And so a lot of people are sitting hunched over at a desk, or hunched over at lunch, or hunched over in the car, and they're not moving well. Their bodies are in a position that has poor digestion written all over it, and so the motility gets decreased in the gut, and they're not breathing well, so that they're not having proper motility of the gut, but the diaphragm as well, and that's a huge result of stress and the busy lifestyle that we live. So those are variables that sometimes can contribute to the problem and don't always get accounted for. So we want to be aware of those. Now, I briefly talked about this, testing options. I typically advocate for stool testing. Breath testing is your common SIBO, H. pylori testing. Stool testing is a little bit more comprehensive. It does look at the whole gastrointestinal tract, and it tells you what bugs or dysbiosis is in there. So it's not perfect by any means, and it unfortunately won't always catch all the bugs. So I typically advocate for a multi-day sample, so 1 or 2 or 3 samples over the course of a couple days, so that we can have an average of what's being shown and what's coming out. But you want to make sure that you get a good specialty, comprehensive microbiome stool test, because you can get a conventional stool test, which is going to look for pathogenic bacteria, which is good, but it's only going to look at bugs that really shouldn't be there. So it's limited in its results, in that you're only looking at things like cause really food poisoning. And you would know if you had food poisoning. What we're more concerned about is the microbiome change of what is already there that is possibly growing in wrong quantities and wrong locations. So you want to get a comprehensive microbiome test that's going to look at the normal bacteria as well as the bad bacteria that shouldn't be there. Now, breath testing is also a good option. It looks specifically for bacteria that's overgrowing the small intestine, which is more and more common these days because of the poor stomach acid that we have, because of the stress that we're under, because of our poor motility. You can also do an H. pylori test as well, and that can look for overgrowth of H. pylori, but there are other ways to test for that as well. Now, like we talked about before, conventionally, there's the endoscopy and colonoscopy and the barium swallow. Those are good to rule out further and more invasive diagnoses that need urgent attention. So significant ulcers, if there's bleeding, if there's polyps or cancers or obstructions, those are things that are going to rule out more invasive causes that need to be first addressed before the microbiome gets addressed. So testing is a good idea. Use it in conjunction. I like the stool testing, especially the comprehensive microbiome stool testing. That will give me a lot of information in addition to the symptoms that the patient presents with, which are by far the most important component. Now, treatment strategies. Treatment strategies are very, very, very diverse. So I'm not going to go into all of the options for treatment strategies today. I am going to probably follow up with another video on that. But treatment options, basically, I'm going to do the principles. And that is, you want to support the patient's normal GI function and digestion, as well as focus on the symptoms that the patient is experiencing. So really constipated, a lot of diarrhea, you want to address those things with symptom support. So, I commonly will use magnesium or something like that for constipation. And in diarrhea, you can use a lot of different options like other supplements that help to reduce the amount of flushing that the digestive tract is doing. And that can be binding agents, that can be dietary changes. Bloating is a big one for patients, and so digestive support can be helpful there. So you want to support the patient. That's step one. Make sure that they're relatively stable, because this is not an overnight treatment process. This is going to take a few months, but over that course of time, you're going to see improvement, and you're going to see resolution in the symptoms instead of just management of the symptoms, which is the key. So then, which brings us to treatment principle number 2, identify the problem and treat the problem. Identify the problem. That's the testing. That's the good history that you're going to take to know what's going on. And then once you get the understanding of what the cause is, you treat the cause. And treating the cause may be that you need some type of antimicrobial, antibiotic, antifungal, antiparasitic, anti-whatever to help knock down the bugs or get rid of the bugs that are in the wrong location, because typically that's the majority of the problem, is that they're overgrowing in wrong locations. And so I like to treat the problem directly in addition to supporting the original cause. Was it motility? Was it slow stomach acid? Was it an infection? Is there some type of toxicity you're being exposed to? That needs to be addressed as well, to make sure that you don't have reoccurrence of the bugs overgrowing, because you want to make sure that things are functional. Which brings us to principle number 3, support normal function. So make sure that the gut is restored once the problem is addressed. So I got the bugs under control, I knocked them down, now I got to heal the gut lining, restore the gut lining, restore normal motility, restore normal digestive tract function, and I want to get the microbiome back to where it should be. That's kind of where you start putting things together like probiotics, glutamine. There are really cool new therapies out there like peptide therapies and clostrums and different options to help restore the gut normal function. But you can't neglect the basics. GI functions well with stress reduction, good sleep, good hydration, good food, exercise, mobility, and activity. And so those are the things that you need to focus on in addition to all of the cool cutting edge new therapies. The basics are always part of the equation. So treatment principle options, we talked about, you can do medications. certain antibiotics. So like if you had a SIBO diagnosis, Xifaxan can work really well. Is it perfect? No, none of the treatments are perfect, but you can do antifungals. Nystatin works really well without being absorbed systemically. There are other antifungals that can work. Antiparasitics work as well. The antiparasitics pharmaceutically are really good if you have like this urgent case of severe acute infection. They will knock down that. But if you have chronic related parasites, I typically avoid the medications because they're not going to be comprehensive enough. And that's typically where I focus most of my attention on treatment for antimicrobials on supplements and herbals, because I find that they're more comprehensive in their treatment approach. They take a little bit longer to really get to where you want to go, but they're much more comprehensive in full treatment. And then other things you can do is supplements like enzymes for digestive function, enzymes to break down biofilms, which are formations of combinations of bacteria and fungus that kind of encapsulate in the gut that need to be broken down to treat effectively. You can do mucosal support, like we said, restore the gut lining. Probiotics are great as well toward the end of the treatment protocol to help restore the microbiome to its original place. And then diet has got to be part of your treatment protocol. If you don't have the correct diet in place, you're either going to contribute to the problem, or you're not going to contribute to the solution. So you want to reduce food triggers, reduce the triggers of discomfort. So for instance, SIBO again is a good example, that if you're consuming a lot of prebiotics in your diet, which normally are good, but they will feed bacteria in the small intestine, and so you want to be careful about how much you consume. And then dietarily, you also want to support healing. So I usually put patients on a higher protein diet to help support that recovery process, just like as if you were exercising, you need some extra protein for recovery. And then, like we said, the lifestyle component, you need to have that component in order to have success. So you need to stay active, stay hydrated. I like to do abdominal massage for my patients to help stimulate motility, sleep, movement, exercise, breath work, making sure that our stress reduction is down. And those are all huge components to helping to improve the treatment outcomes. So in summary, it's complicated. There's a lot of details within the diagnosis, the treatment, but the purpose of this was to explain that there are causes to IBS. There are diagnostics that can tell you why you have those symptoms, and there are treatments that are effective to helping to resolve the problem and not just management of the problem. And so working with a good practitioner, someone who knows and understands these ideas is really a great option. And I commonly see with my patients, it takes a few months, but going forward, if these are reestablished, the quality of life increases dramatically. And so I highly recommend people to, instead of just managing their IBS, to it's mostly okay to let's get this under control and resolve this, because if we don't, that underlying problem, which could be a low-grade infection or some type of overgrowth in the gut, could be resulting in long-term consequences and discomfort, contributing to inflammation, contributing to a lot of other factors. So take this information and make sure that you address the problem as you need to, because most people are being affected by IBS in some way or another, even if it's low grade. So get some testing done, see a practitioner, and be well.